Hello, I am Dr. Rajiv Shah, an ICU consultant. Today I want to explain a very serious condition that we see in the intensive care unit. It's called ARDS. The full form is Acute Respiratory Distress Syndrome. In simple words, this is a type of severe lung failure where the lungs suddenly stop working properly and even high levels of oxygen are not enough. My aim in this video is to explain what ARDS is, why the treatment looks so intense and why recovery is often slow, so that families can better understand what is happening to their loved one. The video is for education only and is not a substitute for medical advice or any individual patient. In a healthy person, the lungs are like millions of tiny air balloons. When we breathe in, these balloons fill with air that we breathe in, and oxygen from these balloons moves into the blood while carbon dioxide is removed. In ARDS, because of severe inflammation and fluid inside the lungs, these balloons become heavy and waterlogged, almost like a sponge soaked in water. Oxygen finds it very difficult to cross into the blood, and vice versa, the carbon dioxide finds it very difficult to go out. Hence, the patient goes into what is called as respiratory failure. So even if we give high amount of oxygen from outside, the damaged lung cannot use it appropriately. This is why ARDS is such a dangerous condition. What causes ARDS? ARDS is usually not a disease that comes on its own. It almost always is a complication of something else that is already very serious. Some of the most common causes of ARDS are severe pneumonia, where infection in the lung triggers a strong inflammatory reaction disproportionate to the infection. Another one is sepsis, which is severe infection anywhere in the body that spreads into the bloodstream and making all other organs like the lungs very sick. There are other causes which may be directly related to the lung, like a trauma, or maybe more remotely related, like pancreatitis, which is inflammation of the pancreas. Big road traffic accidents which involve long bones or severe burns, massive blood transfusions are other examples of conditions that are far distant from the lungs, but lungs can be injured, causing ARDS. We can also see ARDS after drowning or inhaling harmful fumes, or in some cases of severe viral infections, which all cause direct lung injury. The important point is that ARDS usually appears in patients who are already critically ill from another problem. From the family's point of view, what do you see when someone develops ARDS? The most obvious thing is very fast and difficult breathing. The patient may be struggling to speak in full sentences, using a lot of effort just to breathe. The oxygen level on the monitor or the pulse oximeter remains low, even when we are giving high oxygen through a mask or machine. On the X-ray, instead of mostly black lungs that show air, we see large white or cloudy areas which represent fluid and inflammation. Because the situation is so serious and progressive, the patient almost always needs intensive care unit care and very often needs to be put on a ventilator with a tube in their windpipe to support the breathing. For families, this sudden jump from infection to ICU ventilator can be very frightening, and that is completely understandable. How do we treat ARDS in the ICU in simple language? The first and most visible part is the ventilator. But we do not just give high pressures and high volumes. In ARDS, the lungs are fragile, so we use what is called as a lung protective ventilation. This means that we use smaller breaths on the ventilator with controlling pressures and careful settings to avoid further damage to the lung tissue, even if that means accepting slightly abnormal carbon dioxide levels. We also manage fluids very carefully. Too much fluid can worsen the lung and the swelling in the lung, but too little fluid can drop blood pressure and harm other organs. Hence, it's a tricky balance that we need to achieve. We often use medicines to support the blood pressure and protect the heart, kidneys, and brain. In some patients, we use a technique called proning, where we turn the patient onto their tummy for several hours a day. This can improve oxygen levels by opening up parts of the lung that were not getting enough air. In very selected cases, in advanced centers, even if the ventilator and proning are not enough, we may consider ECMO as a last resort, as a support, where a machine temporarily takes over the work of the lungs from outside the body and does the gas exchange. This is reserved for very specific situations and is not suitable for everyone. Now, let us talk about recovery and expectations. ARDS is not like a simple infection that improves in a couple of days with antibiotics. The lungs need time to heal, and that healing can take many days to weeks. During this period, the patient may remain on the ventilator, and there can be good days and bad days. Even after leaving the intensive care unit, many patients feel weak, breathless, and tired for weeks or months. There is significant loss of muscle and weight and emotional stress, which are very common even after leaving the intensive care unit. Physiotherapy, breathing exercises, good nutrition, and regular medical follow-up are extremely important parts of recovery after ARDS. Families should prepare for a long journey rather than a quick fix. So to summarize, ARDS is not a simple infection. It's a form of severe lung failure that often develops in people who are already very sick from pneumonia, sepsis, trauma, or other major illnesses. The treatment looks intense because it has to be ventilators, multiple medications, careful monitoring, and many small adjustments every day. Improvement is usually slow, requires time, patience, and a strong team effort. If your loved one is in the intensive care unit with ARDS, do not hesitate to ask the doctors and nurses about the plan, progress, and the challenges. Staying informed and involved can make this very difficult experience a little easier to understand. I hope this video helped you understand the journey of ARDS better. If you find this video interesting, please do like, subscribe to our channel. If you would like to know more about such topics, please mention them in the comment section below. Thank you for watching.